Awesome. It says it's recording. So hi, everybody. Hi, Synergy eTherapy community. I'm super excited to be here today. This is a recording, and we're going to post this to our YouTube channel and post it on Facebook. So feel free, if you want, to join in the conversation. I'm super excited to have with me today Rachel Zoffness, Dr. Rachel Zoffness. She's a licensed clinical psychologist, and she's up in the Bay Area. In California, and what's really super cool is we reconnected not that long ago, actually. I was her supervisor many moons ago when we worked together at St. Luke's Roosevelt Hospital in New York City. How cool is that? What year was that, actually?
I want to say that was 2011 or 2010.
Had to be, yeah, 2010.
I think it was 2010.
Wow, it feels like forever ago.
I know.
And we reconnected because Dr. Zoffness is a specialist in chronic pain for kids, adolescents, and adults. And I just thought this would be such a cool thing to have her on and talk a little bit about chronic pain, how she got started, like how this is different. And then really, like, what I want to offer our community is just a takeaway of like, well, how do you manage this? What do you do? Like, what are some of those signs and symptoms? How do you like cope? If you have a child with chronic pain, how do you help them? And which is really cool, she wrote a workbook for chronic pain, and she'll tell you all about that and another one coming. So welcome.
Thank you.
So yeah, tell us, how did you get started in like this niche of chronic pain and working just with people with chronic pain?
I think some people know early on that they want to do chronic pain work and they want to be in medicine. There is actually a field called pain psychology, but I was not one of those people. I knew early on that I wanted to live at this intersection of medicine and psychology and neurology and pediatrics, but I did not know how to do it. So undergrad at Brown, I did my honors thesis on pain, specifically on the gate control theory of pain. Which just explains how pain works in the brain. And then I just went on this winding journey. I got a master's at Columbia in psychology, but that wasn't exactly right. I was a science teacher at the Bronx Zoo, working with kids in science, but that wasn't exactly right. I went and got my PhD in psychology, and that was specifically CBT focused, and I did a child and adolescent track so I could get more experience. But that was sort of missing some stuff too. And the day I got my license, literally the day I passed my licensing exam, I got a phone call from a friend who's a pediatrician. And he said, there's a pediatric neurologist who works with me who says all these papers are coming out on CBT for chronic pain, and she wants to talk to you. So she and I nerded out on the phone, and we read all these papers together on CBT for pediatric pain. And I emailed the authors of those papers, and I asked, well, what does this mean? What are you actually doing in session with these kids? And they sent me the manual. And anyone who has been trained in CBT could do it. It is not rocket science. And I was hooked, because this is actually it for me. It's the intersection of neuroscience and pediatrics and medicine and kids. It's everything. And I'm obsessed with it. It's like the coolest thing I've ever done.
That is such a cool thing. I mean, to kind of go from one thing to the next, and you're like, I like it, but like, this isn't kind of where it's at. Like, I'm missing something.
Yeah.
And then the day you pass your exams, you get this call, and it's like, oh, it's like that could only happen to everybody, right? Like, oh, right. There's that pinnacle point in my life where like everything kind of just went in the right direction.
I feel really lucky about that. And then she sent me her hardest patient who had been in bed for 4 years. And he had been on all sorts of medications. I think he had been on 40 medications.
Oh my gosh.
And he had missed 4 years of school, and he was terribly in pain. And we started the CBT protocol, and we started seeing change within a couple weeks. Within a couple of months, he was walking outside and then jogging a mile a day, and then got a tutor and was catching up in school. And I went to his graduation last summer from high school, and he stood on stage and said, if you had told me 4 years ago I'd be graduating high school, I never would have believed you. It was so powerful.
So you see such profound changes in the patients that you're working with. And, you know, it's interesting because you think of like anxiety, depression, trauma. You know, what I always say is mental health and the way it expresses itself is really like a physical disease.
100%.
Our mind and our body, it goes together. And when we're, in a traumatic situation, then we can manifest sometimes, headaches and jaw pain and tummy aches and the whole nine. And then people who have conditions, maybe it's diabetes, or maybe it's, I don't know, like MS or really chronic things that are really, really, medically based, you can kind of get that anxiety and depression from there. And then that exacerbates, right, the medical condition. And so how do you see like the mind and body going hand in hand? Like you say, you see transformation. Like, do we see this type of transformation if you're just having anxiety, depression, but no chronic illness? Or like, what do you think about that?
I really love what you just said so much, because I feel like in Western culture, we have this strange brain-body divide, which is not a thing.
Right.
We know, in fact, in kids, one of the primary ways stress and anxiety and depression manifests is in the body. So kids who are really stressed and anxious commonly and understandably have headaches, have GI pain, abdominal pain.
They're going to the nurse all the time. They're not wanting to go to school, a lot of throwing up and school refusal. I see a lot of these kids all the time.
Right. So here we are in the midst of an opiate epidemic, right? Which everybody is talking about, and it's a humongous problem. And part of the reason that came about is because for many years, pain was conceptualized as a biomedical problem, sort of what you're talking about. It was purely biomedical, like it's either tissue damage or it's system dysfunction or it's genetic. But we now know that pain and everything else is actually biopsychosocial. The biopsychosocial model of pain is now this luminous light that's sort of directing treatment. So if pain is biopsychosocial, that means that medication alone or procedures alone or surgery is really not going to be the answer for a chronic condition. For an acute condition, maybe. But for a chronic condition, exactly what you said is true. When you're a kid or an adult and you've been in bed for many months, or you have to drop out of work or drop out of school and you can't see your friends and you can't exercise anymore, of course your mood suffers. Of course your stress and anxiety spike. And of course that's a cycle, because that spins back around to make your physical symptoms worse. So it can trigger symptoms or amplify underlying symptoms. So it's a vicious cycle, and it's all interrelated. There's no disconnect.
Right. And I think what you were talking about, we all know with the opioid crisis, we hear it, at the government level. What do we do about this? And, we're overprescribing, overusing. It's extremely addictive. We are kind of that quick fix culture. We don't want to take too long for anything. Remember when fast food was happening, and then the cell phones came out, and I guess this dates us a little bit. Not that we weren't born when fast food was happening, right? We were born. That was happening long before us. But
I know what you're saying.
You know what I'm saying.
Yeah.
And so we like that idea of like, I just want to take this medicine and it should make everything go away. It should make everything better. And sometimes that can happen, like you said, like for an acute condition, or, for short term, or, you have a headache, you take Tylenol, Advil, oh, maybe it goes away. You drink some caffeine, or, but what if you don't need that? What if, it's a meditation thing? What if it's a mindfulness or a breathing thing? Like, how do we slow down our system in a way that, is still effective? Because a lot of people are going to think, well, the pill is so much easier. I don't have to put all the time and effort into like, how do you meditate? How do you breathe? Like, that's so foreign, where just taking a pill alleviates the pain, but it's sometimes counterintuitive and creates this vicious cycle. So like, what do you say to people about that?
Right. Well, so what research shows is that medication for chronic long-term pain is actually not effective. And we know what actually happens with opiates and some other medications is that they sensitize the brain to pain. So it has this like counter effect. By sensitize, I mean your brain now feels more pain. So instead of decreasing pain over time, you become more sensitive to pain. So it ends up being counterintuitive. We also know from research that evidence-based treatments do exist, like cognitive behavioral therapy and mindfulness-based stress reduction. And there are a lot of, now, they're called alternative, but they're becoming more and more mainstream because we know medication actually doesn't work. So it seems like a quick fix because it helps you acutely in the short term, but long term it causes more problems. Your brain becomes more sensitive to pain instead of less. So
you're talking about like mindfulness, breathing, stress reduction. So if somebody comes to you and they're like, okay, this is my child, this is my adult, my husband, my wife, my partner, whatever, and they've had this condition for a while and it's just getting worse, the medication, like, are they coming to you kind of like they've been knee deep in it for a while, trying to deal with the medications and like, it's like nothing's working and so hopefully this stuff will work? Or are they coming to you as like, hey, I'm starting medicine for this condition. They said I should also do therapy to kind of, get in front of this. What do you mostly see?
So the way I talk about it is like really on the last stop on the train. The families who come to me, the adults, the teens, the kids, they've been through the ringer. The kids that I have seen on average have been to something like 10 medical doctors before they get to me. And again, that's because we have a biomedical model of pain. We conceptualize pain as something that you just go to the doctor for, you take medicine for, but we know that that's not true. And that's sort of sometimes why the condition stays chronic, is because we're not actually targeting the underlying issues. So I really have to frame it for families as, look, I'm a pain coach. That's what I just want to take the sting and the stigma out of therapy, because people often think that if their doctor sends them to a therapist, their doctor is saying, oh, you're crazy.
It's all in your head.
Or it's all in your head. And that's actually not at all what anyone's saying. Pain is biopsychosocial. So if you picture this triangle and bio's at the top and psychosocial's at the bottom, if you're just doing bio, that's only 1/3 of the pain model. So CBT and mindfulness, they tackle the psychosocial piece, which is actually 2/3 of it.
Yeah.
So, and hopefully you're doing an integrated treatment, so you're targeting all three. But so I have to tell people, I'm a pain coach. I'm working in concert with your medical doctor. Hopefully we're just a team working together. But, if it's okay to get a soccer coach to get better at soccer, it's surely okay to get to a pain coach to get better at pain. Mm-hmm. And usually people agree with that.
Agree with that. I think when you put it that way, like that you're there to kind of help improve what the treatment plan already is put in place. So it's like, yes, you can have the medication, you need that perhaps, but you need this and you need that too. And so teaching them the skills for them to implement on their own, but also like, maybe it's art therapy. Like maybe they need art in their life to kind of help them to, calm down and use their muscles, if that's what, who knows what the pain is about. But how do you like implement some treatments? Like what are some of the strategies that you use that are in addition to like the coaching of how to help them with their mind and body? Like what do you do? Like what are some skills, I guess you could say? I'm just totally all over the place right now. I have so many thoughts and questions. I can't even get it out.
It's such an interesting subject. I mean, I'm obsessed with it because it does integrate everything. It's mind and body and it's spirit. It's just everything. So the answer is there's a lot of things. So I think, what do I want to tell you first? All this research is showing actually that one of the most important components of any pain treatment is called pain neuroscience education. Okay. And in CBT, any therapist knows we do a lot of psychoeducation, right?
Yeah.
And pain neuroscience education is that, but very much more specific. So the first thing that you do is you explain what pain is, because people don't know. Like if I asked you, Dr. Lisa Herman, what is pain? Would you know?
Oh my gosh, now I'm put on the spot. I would probably say, like, as if I was like a patient and they say, well, what is pain? I would say something in my body hurts.
Right.
That's probably what I would say. Something feels awful. Something hurts. And it doesn't feel like it's running smoothly.
So you said it exactly right, which is pain is your body's warning system. It's a message from your body to your brain, oftentimes, that something isn't right. And that's true with acute pain, that messages from your body, sensory messages, are telling your brain something's wrong and you should stop doing whatever you're doing and seek help because something's happening that's bad. But with chronic pain, there's this false alarm thing that happens where your brain becomes sensitive to signals from your body and it amplifies its response. So your brain is giving you this false alarm telling you that something's wrong, there's danger, your body's in danger of harm. But as anyone with fibromyalgia will tell you, or even chronic migraine, while it might hurt to step outside and go for a walk, it's not actually going to cause physical damage or harm to your body. So
that's very interesting.
I know. So if you go outside for a picnic with friends when you have fibromyalgia, it's going to hurt, but it's not going to harm your body. And there's a very important distinction, because with acute pain, if you run on a broken ankle, you bet that hurt is signaling harm and danger to your body. So with chronic pain, one of the things we do is we make this very important disconnect between hurt and harm, and that helps reduce pain-related anxiety, and it usually helps people resume functioning.
Wow, that is so interesting. Yeah. So it's like you're cutting that false loop off of like, I feel, it's kind of like that anxiety of having a panic attack in a way. If we could relate this to anxiety of, oh my gosh, my heart is beating, I'm starting to sweat, I'm getting that kind of depersonalization, I'm kind of feeling out of it, I'm getting shaky, sweaty, I must be having a heart attack. And you know what that does? Oh my God, I'm having a heart attack, right? And then there's this negative feedback loop where you get even more anxious, and then you're in the ER.
That's the most perfect analogy I've ever heard, and I love it so much.
Yay!
Because you're exactly right. There's like the catastrophic thing that happens in your brain when there's some physical symptom that feels off or wrong. Yeah. And it's easy to believe, to have that cognition, something terrible is happening to my body, I'm in danger, I have to do something. And so a lot of my patients end up in the ER every time they have a pain flare, and they get put on ketamine and morphine and all sorts of drugs that end up over time.
Right. It's not the long-term treatment plan.
No.
Yeah, I think most of us can, say, especially as we get older and, into our middle 40s or whatever, and that's not even old. But like, oh my gosh, there's this pain, or I bent over and now I can't even get up, and I can't see. And then you kind of go, what's going on? Oh, am I getting older? Is there something that's not working? And you kind of have this negative thing that happens because we're survival creatures, right? We will do what it takes to stay safe, to survive, to avoid danger, and anything that comes in as a sensory input that says, this doesn't feel right, this doesn't look right, smell like, sound right, whatever, we want to fix it. We want to go where we need to go to like get that taken away. And so some of these skills you're saying of like just understanding the psycho ed behind it and like being able to stop and go, okay, is this real? Or is this my anxiety or my negative loop or whatever it is that chronic pain is doing to my brain to then kind of freak me out?
Yep, totally. And interestingly enough, pain is critically important, and people who are born without the ability to feel pain or who ignore those signals don't live very long. So pain is hugely important. And of course, the acute message is you are supposed to stop and stay home and rest and do nothing until you heal. And like you said, the difference is when you have that chronic pain false alarm ringing constantly, telling you to stay inside for months and years, and then you get stuck with the depression and anxiety, which makes everything worse.
Right. And so there's that, where there it goes, spiraling. It's really incredible what you are doing, what your niche is, and the people in California that you're helping in the Bay Area. You recently wrote and published a workbook that people can find on Amazon, and I'm going to post the link in the comments. What is that book called?
It is called The Chronic Pain and Illness Workbook for Teens. Apparently for marketing purposes, you can't have it be for all children. It has to be either children or teens, and you can't have it be for children, teens, and adults. Don't really understand why. But it was born just out of necessity. There are not very many resources for people with chronic pain, especially youth. So when you're doing CBT and mindfulness, you have a lot of handouts, as you know. You always want to give the resources to the person who needs it. You don't want to be the holder of the information. Right. You want your clients to be the holder of the information. So in my office, I have this crazy huge, filing cabinet of all these folders that have handouts. So I just put it together into a workbook and pitched it to a publisher and was shocked that they wanted it. But I think we have this pain epidemic and no one knows how to talk about pain or what to do about it aside throw pills at it. So I think, I'm hoping that it will be a useful resource for families, for kids, for teens, for parents and providers as well.
Yeah. To just know that this is a niche in our field, to know that there are people out there providing this type of therapy, where it is really focused on that mind-body connection. Of course, I use a lot of that in my therapy as well. But this is like your training, this is your research, this is like your jam, of really combining the chronic pain. And especially in kids and teens, you hear a lot about this in adults, but you don't hear a lot about this in kids and teens. I don't know why that is, where we don't see or hear a lot about it.
Yeah, it's actually, believe it or not, only recent that it was determined that children, especially babies, even felt pain. Like in the timeline of science, you know, it was sort of like animals and young children don't experience pain. So
Yeah.
yeah, there's a lot less attention to kids.
Wow.
Yeah.
And you're going to do a second workbook, you said, for adults?
I'm hoping so. I'm pitching an adult workbook to the publishers, and I'm hoping that that will get off the ground also, because it's important to have this biopsychosocial explanation out there along with actual tools. So the workbooks really are treatment protocols for therapists who are working with people with pain. And from my experience, even before I was doing pain, I think every therapist I've ever met is doing chronic pain work without even realizing it. Because if you're seeing someone with depression, or if you're seeing someone with anxiety, you bet that they've got some sort of physical chronic symptoms. So I'm just hoping to put this in the hands of providers and, of course, also patients.
Well, that is awesome. I'm going to go online and order one very soon, because I love this idea of kids and adults and having that workbook kind of help guide the treatment and talk about chronic pain along with the mental health and how it goes hand in hand. And calming one, like you said, of that triangle, you calm all aspects. You can't really do one thing without impacting the others.
Exactly.
So if people wanted to reach out to you, where do they go? What number do they call?
I have a really nerdy website. It's just my last name. It's Zoffness.com, and it has contact info, and it has a bunch of resources. There's a whole resource page on my favorite links and my favorite videos that explain pain, and other websites that have really great articles on pain. So it's pretty comprehensive.